Hi, I'm Kerry Rogers from The Ohio State University in Columbus, Ohio, and I'm here in beautiful Stockholm at the European Hematology Association meeting. And I'm really excited that at this meeting we have a couple results from clinical trials that are going to be presented that I think are really important to the field. One of them is long-term follow-up results, so 9 years of follow-up from a study called CLL14. This is the study that led to the approval of the regimen with Venetoclax and Obinutuzumab for about a year of treatment as an initial treatment for CLL. And it's showing just how well people did over time taking that regimen. And also has some interesting results where we can see that, people with deletion 17p in their CLL have shorter remissions, and people with IGHV-mutated CLL have really long remissions. So we haven't gotten to see all the results yet at the meeting, but I think it's really exciting just to see how well people have done with that regimen that's now an approved and standard treatment. I also am excited to see that there's some results going to be presented with some really novel drugs. So there's a class of medication called BTK Degraders. So as we all know, drugs that inhibit the BTK protein in CLL are very effective. But one way the CLL can kind of outsmart these drugs, BTK inhibitors, which are drugs like ibrutinib, zanibrutinib, acalabrutinib, pirtobrutinib, is by developing a mutation in BTK that limits the drug binding to the protein. So these are drugs that actually just cause the cell to degrade or eliminate the BTK protein entirely. So it kind of overcomes some of the resistance CLL cells can acquire to these really effective medications. So these are still early phase studies that use those BTK degraders. None of them are approved, but we're going to see follow-up from some of the studies with these. And so far what we've seen with them is really fantastic, but people had only taken them for a couple of years. So I'm really excited to see that people are doing well with these drugs going out farther. That's going to be really exciting at this meeting. And then lastly, we're getting some follow-up data with a combination of Zanibrutinib and Sonrotoclax. So Zanibrutinib is an approved BTK inhibitor, and Sonrotoclax is a BCL2 inhibitor, so the same class of drugs as Venetoclax, but a different version of that. It was just approved in mantle cell lymphoma, but is not approved in CLL, but it's being given in combination together. And there's a phase 3 study with this. So phase 3 studies are randomized trials that usually lead to approvals. But this is their kind of earlier phase study. They're presenting follow-up results. And so I'm really excited to see kind of the results of the Sonrotoclax and Zanibrutinib combination at this meeting.